Welcome to Let Them Talk. I'm Paul DiRienzo, and in a few weeks, actually beginning pretty much now, the preparatory work is going on. The United Nations General Assembly special sessions dealing with drugs is going to be occurring here in New York City. And so I invited Kasia Malinowska of the Open Society drug program, and she'll tell you more about it. And she's here to join us and tell us a little bit about what's going to be going on this year and what's so important about it. And so thank you and welcome to the show, Kasia.
Thank you.
Great. And let me begin by asking a little bit about what does the Open Society do and what does their drug program do? What is it all about? I know we've talked about harm reduction on this show, and I know it has to do with that as well as many other things.
So actually my work at OSF began in a program that is called harm reduction, and we supported multiple countries in the former Soviet Union in establishing methadone programs, needle exchange programs. And what became very clear is that unless public policy changes and unless the environment becomes more friendly to the cause, you can have the best services, but people will not access them. Because if the police is around the corner, if people don't feel safe in accessing services, it becomes sort of futile. So sort of the next step of that work was to take on sort of public policy questions. How do we look at drug laws? How do we look at drug policy? And what recommendations we have to change those and to support those people across the world that are actually putting forward those ideas in their own country.
Now, why is the United Nations play an important role in this? Why is it that there's so much focus, and there's a tremendous amount of focus from organizations in this country and around the world on what's going to be happening this spring at the United Nations? Why is that?
Well, because the UN sets a framework for how we think about drug policy. So UN, there are 3 drug conventions that basically define how countries implement national drug policies. And they're quite important documents. I would argue that while they're important, the human rights documents that we have are more important, and we should really keep those in our minds as we implement drug policy and drug enforcement efforts. But basically, those are the documents that sort of set the framework for how countries think about drug policies. And they're pretty broad, but also very clear in a way that they inspire punishment. They're punitive sort of set of guidelines. And there are those countries that I don't want to say ignore it, but work with the flexibilities of those documents, like Switzerland, like Portugal, like Holland. And so they do what's best for their citizens. But then there are other countries that choose to overinterpret the conventions. And that, for example, would be Russia, that would be Japan, that would be Thailand, and the list goes on. So the discussion that will be taking place now is basically how is all of this working out for us? What have we learned in the process of implementation? And we are trying to inspire with many of our partners across the world a conversation about what can be done better.
Now, there was a number of years ago a previous UNGAS, a previous convention on these special session on these issues, and it had a much different take than this one does.
Right. Well, the theme, I mean, the sort of title of a declaration that came out in 1998 was "Drug-Free World, We Can Do It." So if we take this language seriously and look at it now, 17 years later, so what are we learning? You know, is the world drug-free indeed? What are the costs that we pay for that sort of unattainable and unhelpful really goal?
What has happened in 17 years that's changed people's view on enough that they're even willing to allow you in the door?
Well, so I think we now, well, I would say that we now have so much data that shows very clearly that what we're doing is not working, that it's really difficult to deny. United States, 500,000 people in prisons for nonviolent drug offenses. Today, an interesting statement by President Obama, who said that we're over-incarcerating, and we're really over-incarcerating people for nonviolent drug offenses. If you look at Colombia, if you look at Mexico, 100,000 people dead in the name of the war on drugs. over 1 million Russians infected with HIV, and no harm reduction services available, death penalty in Indonesia. The list is really, really long. And so I think now there's enough, sort of the data is in. Let's look at it, let's work with it and see what can be done better.
Nobody can argue that this isn't like people arguing that if you hadn't tied our hands, we might have been able to eliminate it. We didn't tie their hands. They had full reign to do everything they wanted.
Exactly.
They had 20 years to do it.
Exactly.
And what we look at is what you just described.
Right.
How come they still have the death penalty? And I think one of the most horrendous things is the extent of the death penalty in several countries in which they execute people for possession of marijuana and hashish as well as heroin and other drugs. How does Singapore justify putting 300 or 400 people to death in a year?
Well, so the discussion that takes place around death penalty is really a discussion about how the gravity of the crime, and from perception of people who are anti-death penalty. In principle, no drug offense is can ever be classified as requiring that sort of punishment. And so I think that's the debate and that's the discussion.
Right. A general discussion over the death penalty itself.
And if you listen to the leader of Indonesia, who was trying to articulate his reasoning for all those people that were put to death last year around this time, his explanation was it's because the death toll on Indonesian citizens due to drugs is so high. That it justifies executing those that are traffickers. And that's somewhat of a complicated way to argue for such awful enforcement.
Well, usually even in the United States, you usually have to tie the act to the death. A specific, like somebody murders somebody with a knife, gun, club or something, then they're arrested. But to say generally we should execute you because so many people have died in general.
Yes, and I think what he was pointing out to,
I'm glad they don't do that for automobile accidents.
And what he was pointing out, which I think is a reasonable issue to notice, that overdose is a huge problem, and indeed people are dying. But the way to deal with it is to provide harm reduction services, good education, naloxone, the life-saving medicine that actually can stop the overdose. So public health repertoire is really wide, and if used properly, can indeed save lives. So I found that argument extremely complicated because there are many tools that leader of a country has at his disposal and chooses not to use, and instead justifies awful, barbaric practice as almost a drug prevention effort for his country.
It doesn't make that much sense, in other words, and it doesn't. And I think that we're getting into the whole idea of just what it is about drugs that scares people so much that they can't really deal with it as a public health issue and social issue that it is. But let's go around the world to places that have taken a more progressive view and give sort of the opposite, the yin to the yang of this idea of just putting people to death. Let's look at Switzerland, Holland, even Canada, part of this, Colorado here, even changes happening in the United States, Uruguay, and these places. What's happening? What has Switzerland, for example, decided to do?
So it's interesting because even though we have those conventions that we mentioned earlier, countries that actually choose to really take care of their citizens are looking for ways to implement practices that make sense in that particular country. So in Switzerland, relatively early on, heroin maintenance program became one of the pillars of their drug treatment. The assumption was that if some people do not do well in abstinence-based programs, if they don't do well on methadone, then let's give them another option, and that other option is actually to maintain them on sort of slow, steady doses of heroin. And so, this is an interesting principle because it's not about abstinence, it's about improving someone's quality of life. And it really makes sense because if you think about any other interventions, medical interventions, that really is the goal, right? Right. It's about improving someone's quality of life. So that was the choice that Switzerland had made. Right.
And there actually you can go. There's places where you can go purchase heroin.
Well, I mean,
how does it work out?
It's not only you don't need to purchase it. You actually, I mean, health.
Yeah,
the
what
National
happens?
Health Insurance covers it as
National Health Insurance. I
Yes.
don't know anything about that. Never heard of it.
Yes.
It's not Obamacare? So tell us what that means. What does that actually mean? How does that work in Switzerland if you're an addict and you need your fix? What do you do?
Well, if you're an addict and you don't want to purchase your heroin on the street, you in fact want to sort of get out of the black market and the lifestyle of someone who is drug dependent, then you go to a clinic, you get assessed, and you have an opportunity to explain what is your drug history, how long have you been taking, what are the quantities, and you get recommended for heroin maintenance program if you meet the criteria. And so it's actually quite interesting, because I think for many people this is just really a surprising sort of discovery, particularly in Switzerland, which is not a bastion of liberalism. It's a pretty conservative country.
But
it was
their streets clean.
It was a very rational decision. You know, this is how we're gonna make sure that people are not on the streets, that they are safe, and that they are not engaging in criminal activity. I actually went to a heroin maintenance program for the first time when I was in Switzerland, taken there by a police officer who was beaming as he was introducing me and showing me the facility. And so it was a little surprising to me that it was a cop that was telling me of the benefits of heroin maintenance program. And he said, listen, if people come here and receive clean heroin, they're not overdosing, they are not buying it from drug dealers. So public health basically became a solution to a criminal justice program issue. And so that's one of the examples of how countries have managed to work out a solution that is appropriate for them.
I think I saw a photograph. Someone sent me a text or on the internet, and it showed a room where it's like sort of study carols, and people are sitting and they have their needle in front of them, and there's an official walking back and forth, observing, helping them if necessary, and the people are sitting there and with a mirror so they can see everything. All the works are there, and then they're collected and put in Sharps box.
Yeah.
And that's the way. And then they go to the park across the street.
Right, and you know, just to be clear, this is not a program that is easily accessible. You indeed have to have a continued conversation with professionals who actually understand your dependence and understand your drug use patterns, and you know, if you or I walked into that clinic,
you couldn't use it to get addicted.
Exactly.
You already have to be addicted.
And you have to be heavily addicted.
Heavily addicted, right.
Yeah.
You can't just go there to get some free heroin for a party, right? No. And I didn't think so. And I think that's when most people understand that this is actually dealing with people who have very serious, their control of their addiction, of the negative aspects of their addiction, because I like harm reduction. It's the negative aspects of the addiction that are more worrisome to me than the individual choice the person might make, whether to use the drugs or not. And obviously in some of the stricter countries, the moral issue, and stricter parts of the United States, the moral issue of how dare you do this, is at a higher level. Is to you as a harm reduction advocate, is there a moral issue to drugs?
Well, I'm a harm reduction advocate and also a public health professional. So for me, public health interventions are not about judgment. Whether they relate to people with cardiovascular problems, blood pressure, or drugs. If someone is not taking their blood pressure medication properly, or if they're not exercising, we would never say, well, we'll punish you for it. And so for me, the same logic applies when it comes to people who are dependent on various substances.
Which do you have because to me the worst negative effects come from the most commonly used drug of all, which is alcohol. And to me, that's legal. Pretty much anybody can walk in, and whatever the age laws are, it seems to me if you're tall enough to go over this counter in the liquor store, you can walk out with a bottle of something. So what do you think of alcohol, and isn't that really by far the bigger problem than all of these combined?
Right. There is a sort of scale that was proposed by Professor Nutt from the UK, who actually tried to measure harm of various illicit substances, and definitely alcohol is the leader. And one thing to keep in mind when you're thinking about sort of the harms of illicit substances, the first sort of question to ask is, can you die of it? And clearly, alcohol induced death is something that
I forgot the number, 50,000, 100,000,
so
more than that, probably.
And so it's interesting because this discussion, for example, between, is cannabis as dangerous as alcohol?
Right.
Well, so the first question, that you ask is, can it kill you?
You're an expert. Has anybody ever, into your knowledge, into your professional knowledge, ever died from marijuana?
Right.
Nobody
I mean,
has.
we know that
Nobody's
that's
ever
not the
died.
case. Exactly.
If there was one person who died, we'd be hearing about it, right? From the
Exactly.
advocates,
So-
people that oppose it.
So I mean, you of course, of course you have dramatic situations, as in any other, sort of life circumstances where accident can happen. But if you are to be fair and honest about risk of various substances, I mean, alcohol definitely is the one that we should be worried the most
Right,
about.
right. And we already tried prohibition with that in this country, and Russia tried prohibition, and it never works.
Yep.
It just makes it worse. I mean, people
Exactly.
start making it in their bathtub and then
Exactly.
getting wood alcohol. Right?
Yeah,
Right.
and what prohibition does, which we don't think about, is that it really inspires people to concentrate those substances, and we've seen that in prohibition.
Right.
I mean, obviously, you're not gonna transport barrels of beer. If you can get caught by the police, if you can, you are going to go for the smallest possible container, and it's the same. It's the same when it comes to other substances.
Heroin and cocaine.
Exactly.
And
You're not
methadone.
not gonna smoke opium leisurely when the police is chasing you. What you will do is you will buy heroin, which will be a lot more cost effective, and you're gonna inject it.
Right. Now, there's been a number of documentaries and programs on television talking about how the use of opiates that were being prescribed to people, overprescribed to people, is leading now to a heroin. As people run out and no longer can get the pills that they're used to getting from their doctor, they turn to heroin. And in fact, I was shocked to see a commercial last night. The first time I'd seen it, I'd heard about them, but there's actually a drug they're pushing, a sort of laxative for people who take opioids, so which is a side effect of opioids, which I was told was a shocking event, that we're now selling drugs to people to make it easier for them to take the drugs we're giving them, which is being directly connected to the increase in heroin abuse in the United States and around the world. What do you think about these pills that are being that doctors are prescribing, the pain medication, and how pain should be handled? Because so many addicts, and I'll let you tell me, and we've had folks on this show who said it started when I broke my leg, when I was in a car accident, when I fell off my bicycle, and they gave me something, and that's where it all began.
So, so that's a complicated issue for a number of reasons. I really am somewhat anxious to hear about sort of this reflex reaction that we have of blaming physicians. I think that, as in case of alcohol, some people start and they develop a problem. So I think that it is really important to sort of shine the light on problematic opioid use, and at the same time stay sane about making sure that people who need pain medicines actually get them.
Are you worried it might go the other
Yes,
way again?
yes,
Back the
yes,
other way? I mean, it was
yes,
already
exactly.
bad. They were putting doctors in jail.
Exactly.
Now we have Dr. Feelgood again, and now they're getting ready to put him in jail again.
Exactly.
And this is a strange thing with drug policy, because it does seem to go back and forth. Did you have fear that some of the advances that have come in the last 10 years might,
Sure, of course.
if Ted Cruz gets elected, if there's a change in
Of
government in
course.
Switzerland, it could go the other way?
Well, I don't think that it's going to go the other way entirely, because we've learned something in that process, and I think that those lessons learned have to be properly documented, and they actually will then serve further discussions about how we move forward drug policy.
Mm-hmm.
But I really would want to use those stories of how we deal with managing pain as sort of a cautionary tale, because it's so easy to sort of say, okay, so then pain medicines are bad, and so let's be super cautious about prescribing them. And as a result, people are suffering needlessly.
Yes.
And the story that you are referring to is the story in the United States. But if you look across the globe, basically pain medicines are dramatically over-regulated, and people are suffering awful pain when we could help them very easily. Opioids are cheap. They should be relatively easily controlled but available. Let me tell you a story of ketamine, which is an interesting one.
Special K.
Ketamine is a pain medicine in the poorest country, the only pain medicine that is available. And so because of recreational use in sort of, let me just use, an abbreviation of Global North, there was an idea, well, let's schedule ketamine to solve our problem of our sort of recreational use. We're going to make it unavailable as a pain medicine to millions of people in the Global South. And I think that is this is what is very clear when you think about global drug policies, that it is few countries that have the most power, the most resources, that are setting the policy for the rest of the world. And I think that is precisely what we're dealing with. And it has dramatic consequences for Mexico, for Colombia, for those women in labor in Thailand, in Thai villages that cannot get pain medicine. So it's that, I think it's that level of sort of rational discussion that needs to be injected in how we think about drug policy.
I can see that. Thank you for that. And what I want to do in the next few minutes, we have a few minutes left, and I wanted to ask you, what is it about Ungasted? How can the viewers, people here in New York City, what can we do? How can we get involved? What should we do?
Well, first of all, all of us in New York are going to be hosting the biggest summit on drugs in the world, right? So I think that's an amazing opportunity. That's an amazing opportunity for the local press to engage. That's an amazing opportunity for people in New York to understand how U.S. drug policies are sort of driving the global drug policies. There will be events that are happening. Hopefully City Hall will engage. That's an opportunity actually for the city of New York to think of its own drug policies.
This is an opportunity for people to actually discuss and think about, to maybe do a reset, or at least to sit down and talk about what we've been doing and maybe share some ideas.
Yeah, and New York with stop and frisk, with no injecting facilities, there's a lot to do here. So I think using the opportunity of that meeting right here would be a great way
to raise the issue, maybe out in the streets outside. I think there is going to be a large protest outside. What are the dates that the event, that it's at the height of the
19th to 21st of April.
April 19th through 21st, and I believe on April 20th, which for the marijuana community is 4:20, right, a very important day, at 4:20 p.m., there's going to be a gathering of maybe many thousands of people outside the UN, a legal permitted gathering with speeches and things like that. You might very well be speaking there yourself.
Yes, and we hope that cannabis advocates sort of broaden their horizons a little bit for that particular moment in time.
Tell me about that. We got a couple of minutes. Cannabis activists should broaden their horizons for that particular moment in time. What does that mean? Explain that. It's
well, because cannabis is just one drug, one substance, right? And incarceration for possession, for example, is just one form of
oppression.
Oppression, exactly. So think about poor farmers in Colombia who have their land destroyed.
Who are growing coca.
Exactly. Think about poor farmers in Afghanistan.
Growing opium.
That really have nothing to live on. Think about Think about people who have no access to pain medicines. Think about people who are in chains in some of the Asian countries in the name of drug treatment.
And we know people, I don't mind, I know you can't, but I'll point out people who have had horrific experiences in Thailand and horrific experiences in Indonesia, horrific experiences in Singapore.
Yeah, of course, and people who are
and
on
Japan
death row
as well.
in
Japan,
Malaysia right
Malaysia.
now. So the issue is just so broad that I very much hope that the cannabis community and the broad drug policy community sort of comes together on that day and brings all the other New Yorkers to the table who are concerned about human rights.
Yes,
who are concerned about access to medicines, who are concerned about access and quality of treatment. All those issues should sort of bring us together around ANGAS.
I hope so, and I think it will. We're going to be talking about Ibogaine, for example. I don't know if you've heard of Ibogaine, but
sure.
It's a very important. I think I've been advocating for it for a long time, and it's helped a lot of people. But the whole idea that drug use is not a moral failing, it's not necessarily even a disease. It's a personal choice that sometimes gets out of control with people, and there's things that the health community and the mental health community can offer people to help them get back on track without throwing them in jail or making them feel like, the worst of the worst. It's never worked. It hasn't worked yet.
Exactly.
All right. Thank you very much for joining us, Kasia Malinowska. Kasia Malinowska, thank you very much for joining us. We had a wonderful program, and looking forward to joining you maybe in the streets outside of the UN. Great. Will you be actually inside the UN giving talks and participating?
That's an intergovernmental meeting, so yes. The people that get to talk are the government officials. We hope to be able to have some space to sort of inject the academic, civil society voice in those discussions as well.
And how can we find out more information? Do you have a website that people can go to?
Well, there's a hashtag, ANGAS 2016, that people
UNGASS
yes,
2016.
Yeah. And there are now a number of websites. Let me just mention one initiative, Stop the Harm, which is an initiative that brings together people across the globe to articulate their sort of wish list and grievances with the current drug regime. Easy to look up, easy to engage. It'd be great if the discussion went beyond just drug policy community.
All right, thank you very much, Kasia. And we're going to talk more about this. This is a major issue, and we're going to be back on and having more programs about this on Let Them Talk. So thank you very much for joining us, and we'll see you next week. Thank you.